Hi, I'm Dr. Florence Comite, and we're here at the Age Management Medicine Conference in Tucson, Arizona. And I'm delighted to interview Dr. Kelly Bender from LA, California. And Dr. Bender is CEO and co-founder of Pure Vitality Rejuvenation Center, and located, actually 2 locations, in Los Angeles and Beverly Hills, California. She's CEO and founder of KB Healthy, which is also in Los Angeles, and a membership chair of California Naturopathic Doctors Association. Quite an impressive series of accomplishments, and I can attest to the fact that she's a superb naturopathic doctor, and she participated in our conference here at Age Management Medicine. And the topic was precision medicine, and specifically talking about IV hydration, nutrition, and a number of other aspects that we all wanted to learn. So Kelly, tell me, the topic that we want to hear you chat about is the future of IV therapy in age management medicine, and specifically precision medicine, how you make unique decisions for each individual. Where do you see IV therapy fitting into keeping a person healthy?
Yes, so that was the topic of the lecture that I gave, and it's really interesting. I see a lot of doctors implementing therapies. You gave a wonderful talk on testosterone therapy in women, and I see a lot of doctors starting to implement therapies that are going to help with the integrity of bone and skin, building muscle, keeping people optimized. And when that happens, we also need to optimize our nutrition. So as we are building more muscle, building more bone, keeping our neurotransmitters healthy, our hormones healthy, we're going to need more cofactors, more nutrients, more vitamins, and that's where I see a real benefit for IV nutrient therapy. A lot of times patients are unwilling or unable to ingest as many vitamins as we may want them to. Sometimes patients have trouble absorbing. They may have some GI issues, so that's a big population that we serve with my clinic, NIVs, people who just can't seem to absorb enough of the nutrients. So you can do a number of water-soluble vitamins, minerals, and those, a lot of times the B vitamins, magnesium, a lot of zinc, selenium are cofactors for metabolic processes going through carbohydrate metabolism. We know chromium is a big one for diabetics. So I feel it's really important for people as we age. Normally our body tissue would start to deteriorate. A lot of people don't eat as much as they get older, and so being able to use IV therapy to give your body enough of what it needs to keep that tissue at its peak, which is the whole point of precision medicine and age management.
Well, I think it's particularly appealing because I know in our own practice it's very hard to take 25 pills, and
Exactly.
If you just start with that as one factor, and then you have another factor, you're looking at absorption in the gut. And all of us know our microbiome can vary, and a lot of times being exposed to antibiotics or toxins. Other reasons can include just having irritable bowel or issues with the types of pills we have to take. We even have clients who can't really even absorb the particular sizes of the pill. Their gullets are too small. Mm-hmm. So bypassing all of that and knowing you're going to get it into the system, a very easy, example, there are certain elements we need, but if we don't get those cofactors, we can have side effects to the treatment. So it's a way of knowing you're actually bypassing the gut and getting it right to where we need it.
Exactly.
Yeah.
And another one for GI is stress, right? Increased cortisol and sustained cortisol will actually thin the lining, the mucus lining, and then people have trouble absorbing. So I have a lot of patients who would rather come every couple of weeks to get an IV rather than having to take those 25 pills a day. They feel better. It's a better use of their resources. So that's where I see it fitting in. And N of 1, there's a lot of ways for you to tailor the IVs. So oftentimes we'll put people on a multivitamin or these other supplements, but with building an IV in your practice, you actually can tailor it exactly to the patient. So giving them, twice the amount of vitamin C you would give another patient, giving them more chromium or adding selenium where maybe you omit it for another patient really allows you to tailor it to that patient because you're physically making it from all the individual vitamins and minerals.
And that particularly brings us to moving away from things like a Myers cocktail to more precise. But where you actually start, to take a step back, is there's actual specific measurements you can make. So you do testing of different various body fluids and parts, from saliva to blood to even stool, that can actually inform us as to what the mix of amino acids and other particular elements are, so that you can tailor the cocktail that you need at different times. And you also can tailor it to the particular stressors or life that a person is living at the moment, correct?
Exactly. So what we'll try to do is collect as much information from taking good history, like you talked about. It's really important, and sometimes it's missed in this age where we all want the high-tech digital blood and all of the machines. Sometimes we miss just listening and sitting with our patient. So it's important to take a good history and get some labs. We use organic oat testing, which can get functional metabolites, which will tell you if they're low in certain vitamins, minerals. You can also do micronutrient testing and actually directly test how much of the different substances the person has in their body. Genetic testing to know, if they have a mutation in one of their enzymes, you may need to add more cofactors to help that enzyme that's kind of limping along work a little bit more effectively. So that's all really, really beneficial in tailoring it for individual patients.
Yeah, you get to overcome, like for example, we have many patients who have a variant of MTHFR, for example, and in that particular variant, it's hard for them to utilize the B vitamins, particularly folate. They can't methylize it, methylate it. And as a result, you can provide pre-methylated folate right into their system and prevent degenerative kind of disorders, cognitive disorders, and really a decline that would otherwise occur.
Exactly.
That's really fascinating. What I also like is the fact that we can work together as a team, that the expertise that we can provide is naturally matched when we have individuals who have systematic kind of whole system diseases or disorders, or we have to bypass the gut. And instead of having all that expertise where we can approach it in a certain way, but we can team up together to give individuals a kind of insight in certain ways, and then work in sync with you to give them the kind of care they need, or a delivery system that's a little different.
Right. And we love working with you. We love working with other doctors who are managing the patient and who want maybe a different approach. So instead of doing supplementation, doing IVs, or a little bit more guidance on some of the nutrients that might be necessary. And the patients really like it because when we work with people like you who take the time to get on the phone and talk to me, we have communication back and forth. The patient ends up having the best results because they have a team that's really integrative versus, like you talk about, people practicing medicine in silos.
Right, exactly. Well, what would you look at the two top IV therapies that you seem to be your go-to in your current location? I realize it might be fed by your particular demographic, because I know you're, I think, located in Earth Bar, and so which makes it great because that's a natural food, natural herb place. So it's a natural kind of place for people to walk in and see that you offer services. But what would you call your top two or go-to for the kind of clientele you have? Yeah,
so for us, our patients, we have a lot of people who fly, who are bi-coastal or have to fly a lot for business. So we have an IV that's specifically designed, we call it the Jet Setter, but it's specifically designed for immune boosting and to help with energy. A lot of times that's an issue with flying. So two other things I would say for age management is glutathione. We all know glutathione is an amazing antioxidant, and you can give it intravenously, so it bypasses that whole GI absorption. There's conflicting information, I think, about how well you can absorb even the liposomal. But as we get older, we don't make as much glutathione naturally, and so we've seen really good results with skin and being neuroprotective. with the glutathione. So I would say those are the two big ones.
Excellent. Well, I certainly know a fair number of people, including myself, who could use immune boosting and energy.
Right.
I really appreciate it. Anything else you'd like to add as any further thoughts, or you think we pretty much covered it all?
I think we pretty much covered it.
Good. I hope we've managed to touch every base, and we're looking forward to having you back and having you participate again in another Age Management Medicine conference.
Thank you. It's been wonderful.
Thank you.